The death of Nelson at Trafalgar in 1805 is perhaps one of those iconic moments in British history. We think everything that can be said about Nelson has been written. So why did I add to that corpus of literature when I wrote The Seasick Admiral, Nelson and the Health of the Navy? Well, I felt I had something new to say. It wasn't so much Nelson's own personal medical history I was interested in, but in what it tells us about the health of the Navy of his time, and also the way in which his personal medical history impacted on how he treated his seamen. If you like, what we have is a microcosm of the health of the Navy in his day, and the way in which his own ill health made him sympathetic towards improving conditions to keep his men at the peak of fighting fitness. It's a wider story than just the medical history of one great naval hero. Or at least that was my approach when I set out to seek the Seasick Admiral. Perhaps the inspiration goes back to those Forth days when you visited the Victory in Portsmouth. You were given a tour by a young naval rating, fresh-faced, enthusiastic, and keen to tell a story. Now, that story might not have been 100% accurate, but it was usually vivid. And it was good to see Nelson's successors talk about the past. And somehow the contrast between the youth of the serving seamen leading the tour and of the history did make a big impact. It was inspirational and it aroused enthusiasm in the subject. Well, that was many years ago. And in order to pursue this subject, I had to go on many a journey myself. Now, in many ways, I would say that the true heroes of the book are the naval surgeons, especially Mr. Beatty, Nelson's surgeon on the Victory, who attended in him as he died. Now, until the wars against Republican and Napoleonic France in the late 18th and early 19th centuries, naval surgeons had enjoyed a very low status. Nelson was to earn their gratitude by supporting their campaign for better pay and conditions. He, more than anyone, realised the importance of working alongside them to maintain a healthy and an efficient ship. Well, while I was working on the book, I was invited to give an after-dinner speech to doctors, naval doctors in training at a summer school, a mess dinner being held for them at the Institute of Naval Medicine at Gosport. Each year, naval doctors in training of all grades are expected to go to the Institute of Naval Medicine for a course. It brings them all together. It keeps them up to date, gives them a sense of belonging. And at the end, there is a mess dinner. Well, it was a memorable experience. They were certainly more than worthy of their predecessors in their sense of camaraderie, the love of a good time, the enjoyment of a drink. And certainly things would get interesting when they started to compare tattoos amongst themselves. But above all, they had a sense of belonging to a great tradition of naval medicine. I think they might have forgiven me for criticising James Lind at a formal mess dinner that was held in the Lind Room. I had criticised him for not having pushed the anti-scorbutic value of citrus fruits. And indeed, the conquest of scurvy was one of the great medical achievements of Nelson's day, and was one that was pushed by naval surgeons. I was very touched at that mess dinner to be told by one young naval doctor, one woman officer, that I was welcome there, and they liked me because I understood them. That is a great compliment for anyone who has written a book on a particular subject, and also who's had the temerity to address the people who are practicing that discipline today and tell them about the history of their calling. Well, Nelson himself should never have gone to sea. From his childhood, he contracted just about all the fevers that were going. He was impetuous and bold in battle, and so he was often wounded. He lost the sight in one eye and had his right arm amputated. Unfortunately, and this is something well known about him, for a naval hero, he had the misfortune of suffering badly from seasickness. Now, you could say that this personal experience of ill health and injury did actually make him uniquely aware of the importance of health and fitness to the efficient running of the fleet. In the Seasick Admiral, I have very much tried to investigate Nelson's personal contribution to improving the welfare of the men he commanded. This ranges from issues of diet, through hygiene, to improved medical practices. Nelson believed that prevention was better than cure, and he went to great lengths to obtain fresh provisions. He insisted on cleanliness aboard his ships, and even had some understanding of the relationship between mental and physical health, working tirelessly to maintain the morale of his men. Now, many other people of the time contributed to what was to become a revolution in naval health. But you could say that because of his uniquely heroic status, Nelson's contribution was hugely significant. I would even go so far as to claim and this isn't a boast, that my book reveals in detail this role of Nelson's for the first time. Now, the concern shown by the Royal Navy for naval health and hygiene was to give it a great superiority over its foes, which allowed it to take command of the high seas. It also contributes to Nelson's own personal popularity. His death was felt by his seamen bitterly because they believed he cared about them. Now, you might be wondering where all of this research was done. And a lot of it was from archive material. I'd say one of the best sources and most evocative are those wonderfully detailed, very expressive medical journals kept by the surgeons themselves. You can consult them at the National Archives in Kew. But I've also gained great inspiration from visiting the places which evoke Nelson and his world. I've sailed the Trafalgar waters, indeed given a lecture on the evolution of naval medicine to passengers on a cruise ship whilst sailing through them. HMS Victory at Portsmouth, of course, is not to be missed. But they're also the former naval hospitals of Haslar, Gibraltar, Malta and Minorca. I have fond memories of speaking in aid of the restoration of the first permanent British naval hospital at the Isla del Rey in Mahon Harbour in Minorca, very first British naval hospital. So it's always great to see where history happened. I was also pleased to be able to finish off writing the book off Abu Qir Bay, site of Nelson's victory at the Battle of the Nile. That time I was lecturing to passengers on a cruise ship, the Pacific Princess, at Easter 2015. My lectures were on the history of medicine. It included an account of naval medicine and of Nelson's contribution, and just felt right to be finishing off a book about Nelson and health at the site of one of his greatest battles, one of his great victories. Well, in all of this, I feel I too went on a journey of discovery. And so I salute Nelson and his band of brothers. I also salute the naval medical personnel who were also bands of brothers. So I give a toast to sickly season, the opportunity for promotion for them. But let's wish continued and good health to all who serve in the Royal Navy. That would be Nelson's true legacy.